So my name is Rachel Stappler. I'm a physician assistant here at North Bend Medical Center and also privileged at the Bay Area Hospital. I'm a reserve law enforcement officer for the city of Myrtle Point. My scope of practice is internal medicine and pain management. And in about 2010, when I became a physician assistant, I moved back home. I'm from here, born and raised, and began seeing extraordinary amounts of pain medications that were not being taken appropriately. I saw a lot of addiction and really felt the need to help change the community where I came from. As I have grown in the practice of medicine and providing pain care for patients, I've seen a lot of folks struggle with mismanagement of medications or ineffective pain management where they're just not achieving functionality, quality, and all the way up to addiction and mismanagement, which with pain medications there's a 40-fold increased risk for heroin addiction when we mismanage pain medications. And so I felt very moved, near and dear to my heart, to help address the public health crisis. And so I began working with law enforcement officers, understanding what happens in the general public and what we can do as medical providers to help take better care of people and to be more appropriate with what we're doing. So subsequently, I have chaired the Drug Disposal Coalition for the last 3 years, which has been a wonderful experience. And the whole goal of the Drug Coalition is to provide appropriate disposal sites for medications so that they don't end up in the waterway system into the hands of people whom they don't belong or being diverted onto the street for cash. And so we now have 2 receptacles, one at Coos County and North Bend Police Departments, and we hope to put one at North Bend Medical Center and then eventually Bay Area Hospital so that the public has multiple safe locations to dispose of prescription medications and supplements. We've had several takebacks now annually, and this last year being the most productive. In 4 hours collected 319 pounds of prescription and over-the-counter medications and 197 pounds of needles for the first time. So we've identified this as a big need in the community and are addressing that. Yes, we are definitely changing the tides, but like I say, we didn't get here overnight. It's going to take us a lot longer than overnight to fix it, but you have a phenomenal group of people locally, the stakeholders at the table. There's law enforcement, there's medicine, there's first responders, the pharmacy communities, or the homeless community, the education community, the faith community. Everybody is at the table, and we all have the same goal. We're on the same page, and I think as we work forward with the Opioid Town Hall Task Force work group, you're going to see phenomenal things happen for people in our area. Anybody who's seeking treatment should have access to treatment. And we have a wonderful facility locally. You know, we're working on medically assisted treatment. There's just a lot of things that we can offer to people. They just don't realize that's out there. They think that that's just the life they have to lead and that that's really their only way, when we know there's just a much better way to live life. So you and I know that, but they don't know that.